Permethrin 5% cream. Permethrin is a synthetic pyrethroid insecticide, and it's considered the first-line standard therapy for scabies in the United States. People have liked permethrin because it's both scabicidal and ovicidal. So it kills the live mites, but also kills the eggs so that they're no longer viable and they cannot propagate the infestation. Permethrin is approved in a 5% cream in infants 2 months of age and older, and generally it's pretty well tolerated. But it's important to understand that permethrin, like many topically applied medications, does result in systemic absorption. I'm going to run this little video cartoon and walk you through this. So you can see here, permethrin is applied to the skin. It's the white dots. You see the scabies mites up there. It then penetrates through the skin, enters the dermal capillaries, where it now is in the systemic circulation. Because it's very lipophilic, permethrin can deposit in fat-containing organs, and those include the brain, the lungs, the heart, the liver, the kidneys. Now, fortunately, permethrin is fairly well metabolized in the human body, so toxicity is pretty rare unless it's misused, overused, ingested, etc. There is some data that suggests that resistance to permethrin for scabies is increasing, especially in certain parts of the world, so something we have to keep in mind. Lindane. Lindane 1% lotion is FDA approved for scabies, not recommended as a first-line therapy. And in my experience, it's an agent that many of us just simply do not use any longer. This is a topical organic insecticide. It's also known as gamma benzene hexachloride. And it's FDA approved, but it's second-line therapy. In fact, Lindane, because of neurotoxicity concerns, has been banned from use in the state of California for many years, just to give you a sense of how we view this agent in this setting. It tends to be less effective than other therapies related to its resistance. And let's look at this video cartoon of Lindane. Here you see the drug being applied topically, large amounts. It's very lipophilic, absorbed into those capillaries, entering the systemic circulation again. And again, because it's so lipophilic, can deposit in fat-containing organs. The organ of most concern has really been the brain, because neurotoxicity has been observed after treatment with Lindane. It should be remembered that Lindane is poorly metabolized by the human body. Hence, these fat stores may remain for much longer periods of time. So Lindane is not an agent that I'm in favor of using for this indication. Ivermectin. Ivermectin is an oral macrocyclic lactone antibiotic that has broad spectrum of activity against nematodes and arthropods, so it's good for infestations. Now, its primary use in humans is onchocerciasis, the disease that can result in river blindness, and strongyloides. It has been used off-label, though, for scabies, especially Norwegian or crusted scabies. That form we looked at earlier, which is more hyperkeratotic, more chronic, it's seen in immunocompromised and neurologically compromised patients, and can be very difficult to diagnose as well as to treat. Ivermectin has been shown to have comparable efficacy to permethrin. Generally, it's well tolerated, but remember, it does enter the systemic circulation right off because it's given orally, and it can result in hepatotoxicity as well as cardiac toxicity, especially in patients at the extremes of age, so either the elderly or young infants. It's not recommended in infants who weigh less than 15 kilograms. And let's look at this animated cartoon. Here's an individual who's taken ivermectin orally. You see it breaking down in the intestine and then being absorbed through the intestinal wall into the systemic circulation. There, it has to be distributed now back up to the skin, right, in those dermal capillaries, where it has to diffuse out. It will find its way to the sebaceous glands because they're very lipophilic, and then will be secreted onto the skin surface from there. So it really has to take its time to get to the skin surface. Then the scabies mite has to take up sufficient ivermectin for it to kill. So this is a treatment option that surely can be effective, not approved for this use, and there is some data suggesting some clinical resistance developing to oral ivermectin.